I don't think there shall be one fee that caters for everybody. That is not going to happen anytime soon. Even if the fees are exorbitant, if we have an opportunity to discuss, I think we should have used the opportunity a little bit better by talking at concrete issues. I am glad that you have taken the point that the Constitution allows that every patient who has an emergency must be and shall be treated. I hope that the doctors have heard. In fact, my colleague who said that the hospital refused to accept the patient, you should have named the hospital and the doctor. And I, as Magoha, son of Magoha, will deal with them. Because the Constitution says any patient who has an accident shall be treated in the nearest hospital first before you ask for anything else. Even though we have heard what you have told us, and we shall transmit this to the minister on Friday. Once we have done that, the ball is in the court of the Honorable Cabinet Minister for Health and the good government of Uhuru Muigai Kenyatta. So from that point, do not vilify the board. And the first thing we did was to appoint an ad hoc committee of the board, which sat and deliberated and came up with a recommendation of a reduction of 20% from the top of the 2016 fee guidelines and 20% reduction from the bottom of the 2016 fee guidelines. And that was subsequently brought to a full board. I would want government to empower private medical practitioners to contribute to the achievement of that goal. How they do it, the legislators, the central government, the body, I mean, it requires a sit down around the table so that you move together as a team rather than small groups. And I think it is achievable. These guidelines were gazetted into law in 2016 by the Honorable Cabinet Secretary for Health then, after due consultation with the board and everybody else. So they have been operational. The fact that we are looking at them again, let me say, is a goodwill from our side. Because the board has taken a very firm stand that because of the socioeconomic issues, rather than getting new charges for this year, let us persuade our doctors to scale these ones down as we get a more comprehensive answer, because the comprehensive answer to propel universal health care will not come from the doctors alone. It has to come from everybody else that is involved.